In March 2020, the world faced the reality of COVID-19, with the World Health Organization's mantra being test, test, test to prevent the spread of the virus. In Liverpool, half the local economy relies on visitors. Strict lockdowns meant families struggled with income loss, job insecurity, and heightened stress. Children and young people were hit hard by these pressures and missed out on education and the development that comes from mixing with friends. The toll on mental health and social well-being was immense.
Unbearable, to be honest with you. Couldn't visit family members.
I stayed on my own a lot.
No contact with people. Loads of businesses closed. Everyone suffered.
As one of the most disadvantaged parts of the UK, with high levels of ill health due to poverty, Liverpool experienced more severe cases of COVID-19. Our NHS was at breaking point.
In hospital, we had an inkling, obviously, that things were going to get worse and worse.
Some people would speak to the relative on the phone or have to say goodbye on the phone because they didn't know if they were going to see them. We couldn't have any relatives in.
It's just that fear of how you're going to cope if you get a huge surge of patients.
In November 2020, Liverpool mobilised its excellence in infectious diseases and public health research, alongside the British Army and local services, to deliver the world's first citywide voluntary mass testing for people without symptoms of COVID-19. The mission was to save lives and livelihoods.
We didn't know how our residents would respond to the presence of the army helping to run testing sites.
It was like an army's thing where you'd go and get tested in the park.
My son's in the cadets, so it didn't really faze me.
It was completely surreal to see the army in the city again.
So we asked them and worked with them to produce meaningful messages such as "Let's all get tested," which we used across social media, street signs and all the other channels we could think of.
In the Liverpool pilot, over a quarter of the population volunteered for testing in a month, despite controversy in the media over whether this was a good thing or not.
You do have people who didn't want to test, didn't believe in it.
Everyone had their own opinion on it because everyone was finding out their own information.
They weren't happy.
Asking people to test to save lives and livelihoods when they don't have symptoms and could lose income by being off work in isolation was a leap of faith. But Liverpool's people voted with their feet and came out in the November weather and got tested. The result was an increase in our ability to detect cases by a fifth, fall in known cases by a fifth, and a reduction in the number of people admitted to hospital with severe COVID by a quarter.
Liverpool designed this pilot as SMART, which stands for Systematic, Meaningful, Asymptomatic, Repeated Testing, where communities were to use lateral flow tests to take back control over their own lives, driving out the virus to secure their health, their jobs and their way of life.
We had to test because we had the kids' schools and things like that.
You had to test to basically do anything.
We were tested every single day.
We had them set up like the test centres in the parks and the youth centres and some of the schools that weren't getting used.
As we transitioned from army-run testing centres to self-testing, home testing kits empowered us all to protect ourselves and our families, our co-workers and communities. So we changed the public message from "let's all get tested" to "test before you go." This encouraged responsible behaviour before going to a restaurant or visiting a vulnerable family member. Testing was so common that you were constantly reminded of the need to stop the spread of the virus.
We learned quickly that testing was much more than a test for breaking a chain of virus transmission. It was also a social intervention. For example, one person's testing in a family may affect the whole family's behaviours in respect of their risks of spreading the virus. By providing people with home testing kits, you're encouraging them to protect themselves, their families, their work colleagues, and to act responsibly within their community. In planning for future pandemics, it's really important to consider testing as a complex social and behavioural intervention and not just a medical test. We identified early on that testing might be used as an alternative to quarantine for close contacts of cases. In December 2020, the police, fire and ambulance services were at risk of whole teams being unavailable because they were in quarantine, putting the public at risk. So we worked with emergency services to pilot a test to release protocol, or what would eventually be called daily contact testing. This saved more than 3,000 emergency worker days and protected critical public services.
In early December 2020, Liverpool shops and hotels reopened when other cities were locked down.
Just getting out and being able to do things was just the best thing of all. It just made sure that I was able to carry on my life.
Felt safe, to be honest.
The COVID-19 Standing Advisory Group on Emergencies, or SAGE, received a detailed report from Liverpool on the 10th of December 2020. It showed the benefits of Liverpool's use of linked data and long-standing public health work with communities. A data-driven approach enabled near real-time optimization of the pilot and rapid evaluation of testing performance. This intelligence-led approach is important not only for knowing when to introduce testing, but also when to scale it back and save money.
We identified early on that practical support for those without symptoms who were then asked to isolate was really important, and therefore we recommended income support for those on low incomes who had to take time off work. Ultimately, this wasn't implemented by the government at the time, but there are many important lessons like this one and others in the evaluation report.
By linking test results to the information on internet technology uses in the places where people lived, we discovered that those with least digital access were most likely to get COVID and least likely to get tested. So we recommended to government that tests should be available without needing to use an app or a website. This informed the subsequent national policy of universal access community testing.
In December 2020, the pilot was rolled out nationally as COVID-19 community testing to suppress the virus and to return to life as close to normal as possible.
The vaccine rollout began in early 2021, and near real-time data analytics and our experiences from community testing allowed us to adapt the rollout to areas of low uptake using mobile vaccination units. Another example of the importance of using and understanding the data to make tactical decisions.
In spring 2021, we were acutely aware that the young were last to be vaccinated, and that mass gatherings like concerts, which are important for their social development and mental well-being, were still closed. Big events are also important for Liverpool's economy. So we used what we'd learned from mass testing to experiment with reopening events safely, using testing, tracing, and communications about minimising risks. On Maybank Holiday 2021, over 12,000 people from Liverpool City region attended 2 nightclubs, a music festival, and a business event. They had to have a negative test to get into venues, and they were asked to minimise mixing in the week before and after the event. They didn't have to wear a mask, as international attempts to do this found that event-goers took them off. There was also vigorous contact tracing around anyone testing positive. The result was only 15 cases of COVID linked to these events, no more than the background rate at the time. Using the same detection system, we picked up over 50 cases linked to a nearby leisure centre. So the safety net worked, and those who attended the events and the wider community reported really profound joy.
So, what did we learn from community testing? Experts from across the UK, with the support of the Pandemic Institute, on behalf of the UK Health Security Agency, have been looking back at the lessons learned from community testing for future pandemics. They emphasised the importance of clear communication of the purposes for testing and a data-driven approach to ramping testing up or down quickly as needed. The Community Testing Review has defined 3 important points that should be considered anywhere in the world for pandemic testing preparedness. The first is to develop a blueprint for purpose and data-driven pandemic testing and use it in scenario planning. This includes having one of the following clear purposes for testing. Test to validate, using lab and field experimentation to evaluate the technical performance of the test. Test to diagnose people suffering from the disease. Test to isolate people infected or likely to be infectious with or without symptoms, including those traced as close contacts of cases, to protect the vulnerable or to reduce community transmission. Test to release from quarantine or isolation. Test to access high transmission environments such as indoor mass gatherings, air and rail travel, or high consequence settings such as care homes. Test to treat, rapid access to antivirals in the community after a positive self-test. Tests to confirm, such as PCR confirmation of a positive lateral flow test. Tests to understand, to generate data for research or public health surveillance. Second, publish protocols informed by the blueprint and scenario planning exercises. Third, test and refine the principles, plans and protocols through continuous preparation between pandemics. The Pandemic Institute is at the heart of a much larger global network of partners, and COVID-19 has demonstrated the need for global partnerships and the value of their ability to rapidly assimilate research across a global network and to respond rapidly anywhere across the world.
The next pandemic could be just around the corner, and the preparations we make now can help tackle other big problems like NHS winter pressures. COVID-19 taught us the power of data, real-time actionable information, clear, purposeful communication, and community involvement. Liverpool was able to write the playbook for COVID-19 testing because of its people. Half a city volunteering to get tested despite external media criticism was remarkable. I want to thank the people of Liverpool for all they did in COVID-19 and have done many times before to advance public health.
I was happy that people look out for each other.
Liverpool now coming together. The people are just amazing.
We're all just proud to be Scouts.
We do come together. That's the best thing about Liverpool.